Hi, welcome to this video. Thanks for your interest. If you're part of this year's UChicago App Challenge, great and good luck. I'm Eric Ginsberg, Assistant Director at UChicago Tech, the university's Center for Technology Development and Ventures. I've been working here since 2001. UChicago Tech drives the movement of university research into tangible products and services. I'm not going to be reading all the words on the slides. The slides will be posted later. But I'm just going to give you an overview of some issues you should know about for Phase 2 of the challenge. First, a little intro on UChicago Tech, a little more intro. Our office is in constant communication with researchers across campus. We help determine what aspects of their research could be best disseminated together with a commercial partner. We also have a number of programs that you can see on our website working to foster the entrepreneurship ecosystem across both campus and across Chicagoland. We have about 20 people in the office and many more details at our website, tech.uchicago.edu. So for the App Challenge, we've been a co-sponsor for several years together with IT Services and the Polsky Center. For the App Challenge, we're a resource for Phase 2 of the App Challenge. By the end of Phase 2, all the entrants should be able to discuss in some detail applicable issues surrounding your app that I'll address in this video. We can provide answers to your questions or help find you answers. We work a lot with the university's Office of Legal Counsel, for example. But I should tell you, this is not legal advice. Just an introduction to some issues that could be relevant to your project. So the issues to think about are intellectual property ownership, intellectual property protection, freedom to operate, FDA regulations, and HIPAA regulations. And again, I'm not going to give you all the answers, just make you a bit familiar with what the issues are. So first question, who owns my app? And the overall answer is it depends. The university has existing guidelines for determining the ownership of software and other intellectual property. These same guidelines apply to apps, and participation in the App Challenge doesn't affect ownership. That is, the rules are in place for all activities at the university, and there aren't special rules for the App Challenge. Factors that go into the decision include whether the app's part of a research project in the university, whether you're collaborating with others, are you paid by the university to develop software like this, and also a special rule at the university is whether the app or the software is more like a book or is it software that manipulates data. There's a lot more info at the App Challenge website. I've indicated the link to follow. There's lots of good info. Follow the who owns what in the process link. About protecting your app. Should I patent, trademark, or copyright my app? Patents, first of all, protect inventions. And I've listed a number of factors that go into how our office decides in general whether or not to file a patent on any work. For apps, it's pretty rare that the market size is large enough to justify the cost of patenting. But if you have any questions, come talk to us. Copyright is another form of intellectual property. Under copyright laws, your original code is protected as soon as it's written. You can talk to us more, or you can look at copyright.gov, the government's website. It's pretty good. Trademarks cover the brand name that might be associated with your app. If you have a very good brand name, it can't hurt to put the little TM next to the name. You see a superscript TM. There's a next step you can take to register a trademark. That's more expensive, and there's a cost-benefit analysis to be done. We can talk about that. This is a freedom to operate question. Will my app require someone else's intellectual property? And the ground rule is don't steal other people's stuff. And also pay attention if you're using open source code. And we can talk to you about that. The different licenses have different implications. But these 5 points here, did you get the idea from someone else? Are you aware of patents that might cover what you're doing? Are you using code that you didn't write yourself? Are you using images you didn't create? Are you using someone else's brand name? These are questions you should ask yourself. Will my app require FDA approval? Maybe. So the FDA recently came out with a guidance earlier this year explicitly on mobile apps and what they will and won't be watching for. They're not looking at just mobile phones in general. They're really looking at the functionality of the app, what the app does, and whether it performs as a medical device. And the focus is emphasized here. Certain mobile medical apps can pose potential risks to public health. For example, Interpretation of radiological images on a mobile device could be adversely affected by smaller screen size. So radiologists are used to reading on something very big. When they read on something small, will they miss a lesion they should see? The FDA wants to think about that. And they have more examples here. Remote displays of data from bedside monitors, controlling inflation or deflation of a blood pressure cuff, calculating dosage for radiation therapy. So anything that takes an app and makes it into a medical device that could actually adversely affect patient health, the FDA could be regulating the app. They have examples in this guidance of what they're not planning to regulate. And you can look through these things that are sort of a lighter touch, things that provide patients with simple tools to organize data, things that get patients or physicians easier access to data or their patient records. Finally, will my app contain any protected health information? This is an area you should tread carefully. The government has come down and levied pretty big fines for HIPAA violations. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. Complying with HIPAA is a profession in itself. If you think you're heading in this direction and you're not familiar with HIPAA, we can point you to people who can help. This slide contains a definition of protected health information. Basically, it's any information that could actually lead back to the identification of a specific patient. That's it. Those are the issues to think about: IP ownership, IP protection, freedom to operate, FDA regulations, HIPAA regulations. If you have any questions, feel free to call or write. Thanks.